Hi, this is Dr. ARUNKANNAN, orthopedic surgeon from Apollo Hospital, Chennai. I specialize in hip and knee surgeries. In this surgery, I will talk to you about the cost of a knee replacement surgery. So, knee replacement is a fairly common and very successful procedure that has increased in volume tremendously over the last few years. So, as the volumes have increased, we've been able to standardize a lot of things about knee replacement because it is very predictable in terms of both outcome for the patient as well as what we expect in the hospital. Because that is quite well predicted, we are able to work out a cost and give it to the patients in a very predictable manner. So most of the joint replacement centers that have a good volume are now able to give fairly reliable packages, like the final packages in more than 95% of cases. In Chennai, if you see, the cost of a knee replacement will vary depending on the hospital, the category of room you take, and it might vary from anywhere from 2 lakhs to 4 lakhs depending on these factors. If you take a really small mid-sized hospital with just adequate facilities for a knee replacement, where knee replacements are done, it should be coming around 2 lakhs with proper implants and proper consumables. In a good private hospital with multi-specialty hospital with good ICU backup, good round-the-clock specialists like our Apollo Hospital, the cost varies somewhere from 2,75,000 to 80,000 in the joint replacement unit, which is a shared ward where there are multiple cubicles for joint replacement patients, to about 3,75,000 to 3,80,000 Indian rupees for a single room or a private room accommodation where the joint replacement is done. This generally includes about 3 to 5 days of stay, the medicines that are used for the knee replacement in general, anesthesia, the OT charges, the professional charges for the surgeon, anesthetist, physician, nurses. All of these are bundled together and given to you as a cost. And as I said, most of the surgeries for primary knee replacement are finished within this range in general. As far as advanced technology goes, there is now the advent of robotic technology that sometimes adds to the cost if you and your doctor decide to go for a robotic knee replacement. So robotic knee replacement, the implant or the robotic cost is quite high for the hospital to purchase, so they pass it on to the patient somewhat. So it generally costs about 75,000 extra for a robotic joint replacement in general. And the prices of the knee implants itself was kind of fixed or sort of mandated by the central government about few years back, and most of the good imported implants currently range about 70 to 80,000 depending on small variations in what we use for the patient requirements. So that is also included in this package. So the packages are generally for top quality implants in the best of hospitals. The other thing is some people have insurance. For insurance also it is approximately the same rates, but some insurances have fixed packages with the hospitals, and this is generally slightly lower, a few percentages lower than the actual cost that we have to give for other patients. That is because the insurance sort of has a lot of patients and they have a fixed pricing that's been fixed with the hospital. So knee replacement has become a fairly common procedure and a fairly successful one. That is why it's growing in volumes, and because it is very predictable, the costs are generally worked out in packages. With the central government fixing the price of implants, we are able to give a fairly predictable and package that we are able to adhere to in most cases. Thank you.